Most sore throats are nothing to fear. They come, they go, and life moves on. But not all of them are so harmless. A few carry silent warning signs worth knowing. The ordinary sore throat is usually driven by common viruses. Your body fights back, and within a few short days, the irritation naturally fades away. That's normal, healthy recovery in action. Here's silent sign 1. Pain that lingers beyond 2 weeks. Duration is the first and most important red flag. A sore throat that refuses to fade deserves your attention. Silent sign 2. Pain on just one side, rather than general soreness. Localized, one-sided discomfort is unusual, and that asymmetry is exactly why it deserves a closer look. Silent sign 3. Voice changes or hoarseness that simply don't resolve. Everyone gets a scratchy voice sometimes, but persistence is the concerning factor. If it lingers, take it seriously. Silent sign 4. Difficulty swallowing that keeps getting worse. The key word here is progressive. When each swallow feels harder than the last, don't wait to seek help. Silent sign 5. Unexplained weight loss alongside throat pain. When your body sheds pounds without trying, it signals a systemic problem demanding real attention. Silent sign 6. A lump felt in the neck. A persistent, painless lump can mean swollen lymph nodes reacting to something far more serious than a cold. Silent sign 7. Persistent, one-sided ear pain. Surprisingly, the nerves serving your throat also serve your ear, so throat problems can echo there. Here's the danger. Each of these signs is easy to dismiss as just a bad cold. That casual assumption is exactly what lets serious problems hide in plain sight. Some people face higher risk. Smoking, heavy alcohol use, older age, and certain viruses all raise the stakes. Knowing your risk profile changes how seriously you should respond. So what happens at the doctor? A proper throat exam uses a mirror, light, and slim scope to inspect areas you can't see, catching trouble early. It's quick and painless. When it comes to throat cancers, timing changes everything. Early evaluation dramatically improves outcomes, treatment success, and recovery. The sooner concerning signs are checked, the better your odds. Now, the reassuring news. Rapid recovery within days. A fever paired with cold symptoms and soreness on both sides all typically point away from anything serious. So when is waiting appropriate? If your symptoms are mild, recent, and improving, resting at home and monitoring for a few days is perfectly reasonable. But here's your clear threshold. If a sore throat persists beyond 2 weeks, stop waiting. That's the moment to book an evaluation with a professional. What might evaluation involve? Often a thin, flexible scope to view the throat, sometimes imaging scans, and occasionally a small tissue sample. Each step is straightforward. Remember the contrast. Ordinary viral pharyngitis is brief, both-sided, and fading. Concerning signs are persistent, one-sided, and worsening. Knowing the difference protects you. Let's recap the 7 silent signs. Pain lasting beyond 2 weeks, one-sided soreness, persistent hoarseness, worsening swallowing, unexplained weight loss, a neck lump, and one-sided ear pain. Remember the 2-week rule. Most sore throats fade quickly, but if these signs persist, don't wait. Get evaluated. Early action protects your health and your peace of mind. During a typical viral illness, the throat looks uniformly pink, turning red, feels scratchy and swollen on both sides. This ordinary inflammation is your immune system doing its job. A normal sore throat improves a little each day. By day 3, the ache eases, swelling shrinks, and swallowing feels easier. Steady daily progress is the reassuring pattern you want. Asymmetry matters because ordinary infections irritate the throat evenly. When pain and irregular texture concentrate on just one side, that localized pattern deserves a closer clinical look. To track voice changes, note the date hoarseness began and check weekly. If your voice stays rough past 3 weeks with a flat, distorted tone, seek evaluation. Occasional discomfort comes and goes, but steadily worsening obstruction is different. Each week, swallowing feels tighter. If solid foods increasingly stick, that progression is the true warning sign. Losing weight without trying isn't harmless. When the pounds drop while meals stay the same, your body is signaling something systemic. Never dismiss unexplained weight loss. Here's a simple self-check. Using your fingertips, gently press along both sides of your neck, under the jaw and down toward the collarbone. Feel for any firm, persistent lump. Why would a throat problem cause ear pain? Shared nerves. The same nerve pathways serving your throat also connect to your ear, so pain gets referred along that route. It's easy to postpone. We tell ourselves it's nothing, that it'll pass, but denial lets silent signs advance quietly. Overcoming that hesitation could make all the difference. One risk factor matters, but when smoking, heavy drinking, and older age stack together, concern multiplies. Combined risks compound. That's why context always shapes the picture. A proper throat exam is quick and painless. Using a small mirror and light, a clinician gently inspects your throat in just minutes. There's nothing to fear. Timing changes everything. A concern caught early is small and manageable. Waiting too long lets it grow. The earlier you act, the simpler the path forward. Here's your simple framework. Green signs, quick recovery. Cold symptoms, both-sided soreness. Red signs, pain past 2 weeks, one-sided, worsening. When in doubt, get checked. If these signs persist, take the simple step. Walk through the door and get evaluated. It's an easy, low-stress visit that brings real peace of mind. Most sore throats fade on their own, but remember the 2-week rule. If pain lingers, don't wait, get checked. Your peace of mind is worth it.